my name is Sydney. I'll be a student nurse today, and I'll be going to do a full head-to-toe assessment for you. I'm going to close the curtain for privacy, and I'm going to do my hand hygiene. Can you verify your name and date of birth for me?
Carly Skinder, 21706.
Okay, can I verify with your wristband? All right, that is correct. Are you any age today? Okay, I'm just going to do a quick assessment on you. Can you please tell me where you are today?
I'm at the hospital.
Okay, what's your reason being here today?
Just for a checkup.
Okay, what's the year?
2026.
Okay, and who's the president?
Trump.
Okay, patient is oriented times 4. It's going to adjust your skin. Your skin looks appropriate for your ethnicity. Okay. Are you having any, I guess, any change in skin temperature or anything? Okay, you're not feeling cold or anything? Okay, good. I'm going to check your skin. I'm going to check your... Okay. Capillary fill is less than 3 seconds. We'll go back to the nails in a second, though. Oh gosh, I hate this part. Okay. Trying to think. Patient is dressed appropriately for the occasion. She looks well groomed. I don't see any that's a concern. Everything looks appropriate. No abnormalities at see. I'm gonna check your hair. Okay. Hair and scalp are clean. Height. Everything looks good. There's no infestations. And then we check your hands again. Okay, nails look clean. I don't see any signs of clubbing. Again, capillary refill is less than 3 seconds. And then skin feels warm or coolish to warm, so and dry. I also don't feel any edemas when I just checked your upper extremities. Alright, well, I'm sticking up to the top half. I'm going to assess your head. Okay, so your head looks, the patient's head is normocephalic with no deformities. And then eyes, check your eyes. Okay, these are pretty. Okay, alright. Eyes, pupils are about a 4 millimeters bilaterally. I'm going to check for your direct and concentric, okay? I'll have you just look ahead for me, okay? Okay. Okay. And then I'll have you look to the top up there, and then look at this pen. Look up to the top again, and look at this pen. Okay. Patient's pupils are equal, round, ready to lie, and accommodate. Okay. Are you having trouble seeing recently, or any blurry visions?
I should be wearing my glasses.
You should be wearing glasses? Okay. You okay? Other than that though, but when you are wearing glasses, everything looks fine? Okay. I'm just going to note that, and are you having any headaches recently?
No.
Okay, I'm going to check your ears. Alright, your ears look equal, and I don't see any deformities or lesions or anything. Are you having any ringing in the ears recently? Okay, all right. Patient's nose looks symmetrical. Can you put one finger on your nose and breathe in through the nose? Same down the other side. All right. Patient's nostrils are patent. Are you having any trouble? Have you had any congestions recently? Okay. Can you say ah for me? Okay. Patient's oral mucosa is pink and moist. Her teeth are intact. And are you trouble swallowing recently? Okay. Good. I'm going to look down on your throat for me, okay? Patient's trachea is midline. No, I don't see any lesions on her neck area either. I'm just going to explain the glaucoma scale. It's just basically testing for your reaction, your response, mobility, and your vision. Okay, and since you actually responded to all my commands and all that, I'm going to give you a 15 for that. Okay. Okay. Now I'm going to check for your cardiac. Okay. Are you having any chest pain recently? Okay. And while I'm at it, I'm also going to check for your respiratory, okay? Since I'm going to have my stethoscope out anyways, okay? Now, have you tried breathing recently? Okay, I'm just going to tell you ahead of time that Dr. did prescribe you a intensive spirometer. Have you ever used that before? Okay, so it's just basically testing to, it's a device that helps you strengthen your lungs, and it helps prevent atelectasis, or collapsing of the lungs, okay? Usually, you would, the way you would do it, you'll breathe in and hold it as long as you can. and you just and then breathe out after you're done. Okay, you're gonna do that about every commercial break. Okay. All right. Do you have any more questions about that?
I do.
Okay. Alright, I'm gonna start up here in the right side of the patient and listening for with my not a bell, the diaphragm. Okay, the second in the mid-clavicular line in the second intercostal space for the aortic. I'm gonna go right across the second intercostal space to the left side to a pulmonic, down to a urge in the third intercostal space on the left, and then the tricuspid, which is the fourth intercostal space on the left. And I'm gonna right down here. You okay with the picture there? Okay. And it's going to be the fifth intercostal space, on the left. Okay. And then I'm just gonna note that we already did your vitals before, so we did check your apical rate and all that. It was about 64. Okay. And then I'm gonna list your lungs one too. Okay. I'm gonna have you just come here for me and sit up because I'm gonna check your back too. Okay. I'm gonna start up here in the right upper lobe. Take a deep breath for me. And I'm gonna go right across to the left upper lobe. Take a deep breath. Down to the left upper lobe. Take a deep breath. And the right lower lobe. Take a deep breath. Now, if you don't mind putting one hand like this for me, and listen to your lateral. Okay. Then take a deep breath. On the other side. Take a deep breath.
No, that's the hip.
Now I'm going to listen to the back. Okay. I'm going to start up here in on her left upper lobe. All right. Take a deep breath.
90 degrees. And Z-track.
And then take a deep breath.
Yes, ma'am. I'm so sorry.
One more time.
For patient Jackie Foster.
And one more time. Okay. Now listen to everything. I'm just going to note that her heart sounds were normal S1 and S2, no S3 or S4 heard in any of the valves, and her lungs are clear. No adventitious sounds in any of them. And she already said no. And I know you already said you did not have any chest pain, so I did not use the bell to check for any murmurs. Okay. I'm going to just listen to your respirator. Okay.
Would they talk?
I know it's awkward. About 12 breaths per minute. Okay, now I'm just going to point out some of your scores. Oh, before I do that, I want to check for your JVD, okay? If you don't mind leaning back 45-degree angle, just right down there. Turn to that side and cough. And turn back to this side and cough. Okay, no JVD present. When you cough, you say, are you having any sputum come up or anything? Okay, good. If you do tend to have that, just if it looks abnormal to you, just let us know, okay? I'm going to just point out to your pulses, okay? I'm going to point out her carotid pulses are right here. Axillary is right here underneath her armpits on both sides. Brachials are right here and where the crease of the elbow. And we'll check for your radial pulse. Her pulses are +2 bilaterally and regular. And I'm going to check for her femorals right here, and her popliteals right here behind the knee, and then her posterior tibia is right here. About a +1 bilaterally strength on both, one and regular. Now check for your posterior tibial. It's about a +2 bilateral regular on both. Okay, and while I'm down here, I'm going to check for any edemas going up. Okay, not feeling any edemas. I don't feel any edemas. Okay, and I just want to make. Were you having any achiness, by the way, down in the extremities? Okay, good. All right. Okay, now I'm going to check for your musculoskeletal. Okay, I'm going to have you stand up for me. Okay. Alright, I'm going to have you walk here, and I'm just going to have you walk forward normally. Alright, and on the way back, I'll have you do heel toe. I don't have good balance. Okay, you can take a seat. Patient's gait is smooth. Patient's balance seems to be intact. Not the greatest, but it's intact though. Are you having trouble walking these days though? Okay, okay. You're not having, again, no injuries or anything that's caused. Okay, just making sure. Okay, now I'm gonna check for your range of motion. Okay, I'm gonna have you just lift your shoulder up for me. Okay, and do it again with a force. Okay, now I'm going to actually have you stand up. I'm so sorry. Okay, now have you raise your hand out. Sorry. Okay, and go, and come down, and then do the same thing again. Alright, good. Alright, and then I'm gonna have you, let's see, let's do it this way. I'm gonna have you flex for me.
First check.
Okay, and then extend.
Second check.
And do the same thing again. And extend. Okay, and then I'll have you take a seat. You can sit down now, sorry. Okay, now I'm going to have you extend your legs. Okay, and then flex. Okay, now extend again for me. And then flex. Good. And I'm going to do it down here too. Alright, and I'm going to have you flex your feet, dorsiflex. There you go. And then plantar flex. Okay, good. And then I'm going to have you dorsiflex again. And then plantar flex again. Okay. And then we're going to just use hands right here. Okay. I am going to, one thing I need to check was for crepitus. So let me just check for that, okay? Alright, I'm just going to check up here. I'm going to have you flex your elbow and then down. Okay, I don't feel any crepitus there. I'm going to do the same thing here. Again. Alright, and I'm going to do the same thing for your wrist. Okay, I don't feel any crepitus in the upper extremities, and I'm going to do it down here. Stand for me, and then down. Good. I don't feel any crepitus down there. Okay, and then I'm going to do a quick, before I move on to the GI, we have you lay down again. I'm going to do a quick safety thing, okay? I understand we're on like submit for something. You just remember. Oh, just another? Okay, never mind. Your safety is good. Okay, I'm gonna have you lay down for me, and I'm gonna just do a quick GI, okay? All right. Are you? When was the last time you had a bowel movement?
This morning.
Okay. And when was the last time you went to the restroom for urination?
About an hour ago.
Okay. Is there any? Is your bowel movement normal? Is there anything new or something? Are you having trouble with? Okay.
Everyone's normal.
And when's the last time you had flashes?
Yesterday.
Okay. All right. And no problem with no issues with that. Okay. And then when you go to the restroom, is it normal? Is your normal color? Like okay. All right. Now I'm just gonna listen to your bowel sounds. Okay.
I'm hungry now.
It's all right. Alright, I'm gonna start down here and then right lower quadrant, so that's where your bowel starts.
We do.
Okay. You okay if I touch you? Okay.
But the whole group does that together. Is what they said. Like our whole.
Okay, bowel sounds are normal active. I'm gonna listen to with my bell and the xyphal process just for any vascular sounds, okay? Okay, no vascular sounds were heard. Okay. Got everything. Did you have any questions or concerns?
I don't think so.
Alright, I'm gonna do my hand hygiene again, and then I'm gonna let the doctor know whether he's ready, okay? Have a nice day.